Good Friday morning, everyone, and thank you for tuning in to yet another weekly sunrise edition of the Alan Fitz podcast, better known as The Chat. Good morning, everyone. My name is Alan Fitz. I am the host for the program. Welcome into the show. And as always, I start off welcoming in our three main listening audiences, those that do agree with what we talk about. They spread the word with positive vibes, good news. We definitely appreciate that. The number two listening audience, well, they don't quite agree with everything that we talk about, but at least they've got enough sense to leave constructive criticism. We greatly appreciate that. We do read a lot of the comments that are, left on some of those social media pages, and yes, we do pay attention to it. And of course, last but not least, we can't forget about the haters out there. These are the people that inspire the chat to continue each Friday morning at sunrise. So let's not forget about those that cannot see the forest because of the trees, and welcome you into the program this morning live from our studios right here in the Texas Panhandle capital city of Amarillo. Now, folks, I've done a podcast on this subject before. This was several weeks ago. We talked about Caprock Advanced Care. This is a new medical facility, or business, if you will, that's going to be opening here in the Texas Panhandle here in Amarillo in the very near future. And I talked about several weeks ago what exactly this place would be doing for Amarillo, what its mission was. I believe it was to provide patients with advanced immediate access to high quality care delivered with clinical excellence, efficiency, integrity, compassion, and respect. And I also had mentioned that I was going to do yet a second broadcast or podcast on this, if you will, and we've actually jumped it way up. I had actually not planned on doing this podcast till around November, but some things have come up, some things have come to light, and I wanted to jump on this again quickly before it opens up and explain to you a little bit more about Caprock Advanced Care. And I think a lot of us out there, ladies and gentlemen, let's all agree to disagree. Is it good or bad for Amarillo? And this is where I'm going with this podcast this morning, and I want to get a little bit deeper into this soon-to-be opening business, if it even does open here in Amarillo. I have actually caught wind that there's a possibility that they may not even open. They're having problems locating a place. And then you turn around and there's something else that's being said that, it may be mid-2027 before they open up. And it's just yada yada this, yada yada that. We're not really understanding 100% what the situation is. Then we hear other wording that yes, they are going to open up. The fact remains that at the time that this podcast is being conducted, there is no verifiable business building, if you will, a place to open this up. So with that being said, we're going to go ahead and get started with the podcast this morning. We're going to be talking about, and I hope that I am pronouncing everyone's name correctly out there. If I do not pronounce your name correctly, I do apologize. But we're going to start off talking about these so-called co-founders, if you will, of Caprock Advanced Care. Sarah Cuneo, Dr. Mary Elhart, Dr. Sad Newsom, Dr. David Pearson, Ashley Rankin, Dr. Matthew Turney, and Caitlin Wynn. Now, Ashley Rankin and Caitlin Wynn are nurse practitioners, with the rest of the doctors being respective MDs. Sarah Cuneo also is a nurse practitioner. Now, folks, let me get in to something here before I get into the heart of this podcast this morning. I want to read something to you that is on the Caprock Advanced Care page. That's caprockadvancedcare.com, and it goes in /employers. And this is exactly what this wording is. And then I'm going to get into this so-called co-founders that they're representing themselves as. It says on the Caprock page that our team is built on years of working in high acuity environments where collaboration, trust, and clear communication are essential. Now, each member brings a unique skill set and perspective, allowing us to approach patient care with both depth and flexibility. We value a team-based model where physicians and advanced practitioners work seamlessly together, ensuring that every patient benefits from collective expertise rather than a single viewpoint. This dynamic allows us to adapt quickly, provide comprehensive care, and maintain a consistent standard of excellence while always keeping the patient at the center of everything we do. We did some checking. That is actually AI generated, ladies and gentlemen, okay? And, you know, that's fine that it is, because, I mean, we have a lot of material on the AlanFitz.com page that is AI generated, and a lot of people are going to AI for this, and that's okay to do that, okay? The problem is, where exactly does Caprock Advanced Care stand in the Amarillo community? And like the title card said all week, is this good or bad for Amarillo? And we're going to let you listeners out there decide on this. I personally believe that these so-called 7 co-founders, and folks, from a personal standpoint, I do not believe that there are 7 co-founders to this. I believe that this is strictly a one-man operation. I believe that that one man himself is Dr. Matthew Turney, which, and I don't know if I'm using the right wording here, scratched around, but I believe that he, if you will, scratched around and found these 7 other people, including them as team members, and representing himself as co-founders, okay? I don't believe that all 7 of the employees that we mentioned at the beginning of the podcast are co-founders. I don't believe that's the case here. I believe that this is strictly Dr. Matthew Turney doing this, and it goes on and on and on to build the relationship within the community. These are the people that I believe that Dr. Matthew Turney has selected to follow him in this clinical experience of this new business that is soon to open here in Amarillo. Now, let me get into a little bit of depth of this and explain to you where you, the listener out there of the podcast, need to make the decision yourself if you actually believe this is good or bad for Amarillo, and if you're even personally going to ever visit this place. Now, I will tell you, from a professional standpoint, that I personally do not like to go into a medical facility and have to wait, okay? And I don't think anybody out there, ladies and gentlemen, disagrees with me on that. We want to get in to see the doctor and get in and out as quickly as possible. The problem is with that is that there's a lot of sick people in the world, okay? And folks, it is what it is. There's a lot of sick people. And you're very, very lucky in an extreme rare condition that you can walk into a hospital, these freestanding clinics that they have here in Amarillo, or, you know, basically just a doctor's office itself, and go in and see the doctor in less than 5 minutes, okay? This really, and I apologize for clearing my throat, the cottonwood tree dust is extremely bad up here right now, and I'm trying to limit myself doing that. I really just don't see this happening in today's society. It hasn't happened. I don't believe it ever has happened in today's society. It's a rarity for a person to be able to do that. So what Caprock Advanced Care is doing, and what Dr. Matthew Turney is doing, and I'm going to give you a little bit of insight of something that we talked about prior to doing this podcast. What Caprock Advanced Care is trying to do here in the Amarillo area is they want to speed the process up, okay? They want you to come into the medical facility, the Caprock Advanced Care building, if you will, when they get it open. And you go in, you sign your name, and within minutes, you're behind the doors and you're receiving care. It's basically a speed-up process from current medical service providers here in Amarillo. Now, let me tell you something that Dr. Matthew Turney told me. Hasn't been that long ago, but it has been quite some time ago. He currently is in emergency medicine with Northwest Texas Hospital System here in Amarillo, and he does not work directly in the hospital setting. He works at the freestanding clinics, and there's only 2 of them that operate here in Amarillo. The first one that was built is at I-40 and Eastern. Technically, it's on the frontage road between Bolton and Eastern, and then they just built the new facility, the Tascosa facility, which I'm not understanding why they named it Tascosa, because it's on West Amarillo Boulevard. It's better than a mile from Tascosa Road. But anyway, they named it Tascosa, and this doctor himself, Matthew Turney, practices emergency medicine at both the freestanding clinics. I believe he's at Tascosa more than he is at Eastern. I also believe that he is the mastermind behind Caprock Advanced Care. And we sat down one day and discussed what's going on with Caprock Advanced Care. And Dr. Matthew Turney told me that Northwest Texas Hospital has a grip, if you will, on them as emergency medicine doctors. In other words, the way he described this is that there's a lot of restrictions on them of what they can and cannot do as an emergency medicine physician in a freestanding clinic. And one of the reasons that he thought up Caprock Advanced Care did some of the web designs and directives on the website is because he wanted to be able to operate in a facility where he is in charge, where there is no grip, the iron grip of the hospitals telling them what they can and cannot do. As a matter of fact, if you look at Caprock Advanced Care, you will see their logo on their page. It is a transparent Texas that has the Caprock within the borders of Texas, the blue star of Amarillo, and the stethoscope that wraps around the state. That is my design that I created for Dr. Matthew Turney for Caprock Advanced Care. He reached out to me because he was having a problem getting the background off of the logo itself. And one of the problems he was having was an AVIF file, and he could not get it released. He contacted me, and we redesigned that logo for him. And yes, he was very appreciative of that. Then he begins talking about, and the way he went about this, ladies and gentlemen, from what I can gather, he is trying to do with this is that he is trying to turn a private, or rather I should use the word independent, advanced care practice into a full-blown hospital, which, they can't do that, okay? But he's trying to get very, very close in doing this. For example, at the Northwest Texas Hospital freestanding clinics, they can take a portable x-ray. They can do lab work. But they're restricted versus what a hospital can do. He's also restricted on what he can order as far as, things into a hospital. He does have the authority to admit someone into the Northwest Texas Hospital from the freestanding clinic. But Dr. Matthew Turney has come up with an idea that partially, I believe, does fit Amarillo, but in the long run, I think it's a bad thing for Amarillo. And folks, I'm going to explain this to you right now. And now, I'm not trying to offend anyone. I'm not trying to mislead anyone on this podcast. But I'm going to speak from a personal standpoint, not a professional standpoint. I'm going to speak from a personal standpoint about Caprock Advanced Care. Again, I said that I do believe that Dr. Matthew Turney is the mastermind behind the creation of Caprock Advanced Care. I do not believe him titling himself as a co-founder is appropriate in this situation, but it is what it is. From a personal standpoint, I believe that Dr. Matthew Turney is money hungry. Okay, and again, folks, I'm not trying in any shape, form, or fashion to offend him or anyone out there listening to this podcast. Where I think the bad idea is, and where I come up with him, from a personal standpoint, believe he's money hungry, is because he is not doing something that 95% of most healthcare agencies do. Ladies and gentlemen, I'm here to tell you right now that when and if Caprock Advanced Care opens here in Amarillo, if you have insurance, you might as well forget it, okay? And this is where I believe that Caprock Advanced Care will eventually fail here in Amarillo, is because they do not offer insurance. Folks, I think we all can agree to agree. There's a lot of folks out there that depend on healthcare insurance, not for just going to see the doctor, not for just going and getting medications and prescriptions filled. There's a lot of people out here that are on oxygen. They rely on their insurance to pay for oxygen refills. As a matter of fact, and I want to give a free plug out there to Care, okay, at the corner of Wallace and Coulter. One of the leading businesses here in Amarillo with oxygen refills. They even have a lot of medical supplies that insurance covers. For instance, they have, in addition to oxygen bottles and refilling their own oxygen bottles, they have nasal cannulas. They have shower chairs. They have portable toilets, bedside commodes, I believe they're called, and wheelchairs, walkers, and things like that. And you have a lot of people, especially senior citizens, that have Medicaid, they have Medicare, and things like that, that rely on their insurance companies to pay for medical supplies such as what we're talking about at Care, okay? But with Caprock, this is a completely different ballgame. I mean, ladies and gentlemen, it's a complete 360. They don't take your insurance at Caprock Advanced Care. Now, I'm going to get into this now from a professional standpoint. I'm going to tell you why I believe that Caprock Advanced Care will not take insurance. Number one, and it could be what I said earlier, and again, no offense to anybody, money-hungry doctors, okay, cash. All right, cash on the barrelhead. Money talks, and everybody knows BS walks, okay? That's basically what I'm getting from reading the Caprock Advanced Care page. Either you have money to pay us after we treat you, or you can join the homeless population here in Amarillo and walk out the front door and go pitch a tent under a bridge. No, ladies and gentlemen, I'm not saying that Caprock Advanced Care said that, because no, they did not. But if you go and look at their page, caprockadvancedcare.com, it's all about one thing. It's about money, cash. They have subscription services. They have non-prescription services. If you can't present your insurance, and you're not a subscriber, then there's a visit fee charged per encounter. The problem is they do not say what that fee is. They can't really put it on there because it depends on what service you're getting, and it was probably too long of a time period to work on the webpage to put all that information in there. Now, you don't have to have a subscription to walk in there. They'll see you with or without a membership because that's the law, ladies and gentlemen. They're bound by law to see you, to hear what your issue is, and to treat you. Whether you have insurance, whether you have cash, or anything, okay? But the way that the web page is written out, it seems to me like a money-hungry organization, okay? You have to pay to be a subscriber. You have to pay if you're a non-subscriber after you're seen by the doctor. And the way that it's written, it's cash up front. It's almost like reading through this, that if you walk in to Caprock Advanced Care and you don't have money, or you don't have enough money to pay for this after they treat you, it's almost like they're indirectly saying, we're going to file a lawsuit. Now, folks, it doesn't say that on caprockadvancedcare.com. But in the wording, if you twist and turn it, it's almost like that. Now, that's a good way to run your patients off. Every time somebody comes up there, you file a lawsuit on them because they're $5 short. They're not going to come back, okay? This is one of the reasons, and I said one of two. This is one thing that I'm seeing on the webpage. It seems like it's a money-hungry advanced care establishment because they don't take insurance. Which brings me to number two reason of why they may not be taking insurance. I'm led to believe, and I've heard this from a lot of doctors, not just here in the Amarillo area, but everywhere you go. Some of the doctors will talk about, well, we don't take Medicaid because it takes them too long to pay. Well, folks, I think Medicare is the same way because that's the government, okay? It's like the Internal Revenue Service. It's the government. If you owe them money, they want you to pay them immediately. No delay. If they owe you money, well, you're going to sit around on your can for a while and wait on it. But why? It's because it's the government. And this may be one of the reasons that Caprock Advanced Care is not taking insurance. But I think where Caprock Advanced Care is making a mistake with this is not everyone is on Medicare and Medicaid. Take me for example. I have Blue Cross Blue Shield of Texas. Now, Blue Cross Blue Shield is not the government. It's the state, okay? But it's not the government. Blue Cross Blue Shield pays out quickly on claims to doctors, to hospitals, to healthcare providers. There are a lot of insurance companies out there that pay out way faster than Medicare, or even way faster than Medicaid, because Medicaid is state, Medicare is government. I talked to Dr. Matthew Turney concerning why is Caprock Advanced Care not willing to take insurance policies on its patients. He never would answer the question, ladies and gentlemen. Again, that question was never answered. He changed the subject, went on to something else. Do I believe that Dr. Matthew Turney knows why they're not taking insurance? Absolutely. And it's one of two things, folks, that I just told you about. Either they don't want to wait on the government or the state to pay the claims, which leads me to believe it's number one, it's a money-hungry organization. In a metro city such as Amarillo, Texas, this is not good. Folks, I'm going to tell you why. I know some of you may, when you hear what I'm about to say, some of you may ask yourself, Alan, what has this got to do with medical? But think about it, okay? Think about what I'm about to say. I've actually thought about doing a podcast on this. I have been all over the great state of Texas. From El Paso to Bon Weir, from Texline to Brownsville, and from Big Bend National Park to Texarkana, and every place in between. I have seen the great state of Texas in my lifetime. But in Amarillo, Texas, this is the only city that I have ever lived in my lifetime that I have seen more handicapped license plates than any other city in Texas. Yes, folks, you're hearing me correctly. Handicapped license plates. I'm not talking about the placards, the red or the blue placard that hangs on the rearview mirror. I'm talking about the little man in the wheelchair handicapped license plates. It seems like, and I don't have any numbers before me, but it seems like that over half of this city's population has handicapped license plates. Again, you're probably asking yourself, Alan, what has this got to do with Caprock Advanced Care? What has this got to do with health care, period? Folks, think about it. A handicapped license plate generally means that someone down the line has got some kind of disability. Okay? The disability could be anything from having trouble walking, having trouble breathing, movements of their limbs, and a doctor saw fit to write a prescription for a handicap license plate or placard. A lot of people get handicapped license plates because they stay on your vehicle, and the placards, they can misplace them and have to go get replacements, and that costs more money. So if you have that many vehicles in Potter and in Randall County, then there must be some need for some type of medical care here in Amarillo. Now, I think common sense would impel you to believe that you go to a doctor's office and all the handicap zones are filled up, the handicap parking places are filled up, which fill up quickly around hospitals. So does the freestanding clinics. Common sense would impel your mind to make you believe that if you're seeing a bunch of handicapped license plates, you're also seeing a lot of people that have insurance and they need medical care. Some people, and again, no offense to anybody, I think we can all agree on this. There's a lot of people that abuse the medical system, okay? Going to the doctor every day of the week, Monday through Friday. Every day of the week, they've got a doctor's appointment. They've got to go see the doctor. Some of that may be legitimate, ladies and gentlemen, but a lot of it is abuse of the medical system. It's abusing Medicare. It's abusing Medicaid. These people, unless they are retired from the government, unless they are retired from the railroad system, and unless they're retired as some kind of high rank with the state, they don't have the cash to walk in and pay for medical services. So how do they pay for it? They pay for it with insurance, okay? A lot of people, a lot of senior citizens depend on Medicare. Some depend on Medicaid, and some people don't even have insurance, okay? To have insurance is a blessing, but a lot of people don't have it. But even with those that have Medicaid, Medicare, whatever, Blue Cross, Blue Shield, whatever the case is, Caprock Advanced Care has not taken in consideration of the rush of people. Okay? You've heard me talk on a podcast, in several podcasts, that everybody has to drive 100 miles an hour around Amarillo, always going to a fire that has no smoke. People just do not slow down here in Amarillo. Maybe this was on Caprock Advanced Care mind when they opened this facility up, get you in and out as quickly as possible. What Caprock Advanced Care and Dr. Matthew Turney are not thinking about is, yeah, there's a lot of people here in Amarillo. We've got $1 million homes, especially up around the Bishop Hills area, down on Legend Boulevard, off of Sauncey Road. You've got the multi-million dollar homes, the stucco homes. That's true. But a lot of those people that own those homes haven't even reached the prime of their lives yet. A lot of them are still in their 40s and 50s. And they have very hardcore insurance policies, if you will, to cover them. I don't think Caprock Advanced Care cares about that. I think Caprock Advanced Care wants to get you in and out of there like a McDonald's does. And no offense to McDonald's here in Amarillo, but I'm going, just by everything that I have read, did the talking with the doctors on this, I'm going to tell you what Caprock Advanced Care means to me. And ladies and gentlemen, I want you to listen to this very carefully. I believe that Caprock Advanced Care is similar to a McDonald's here in Amarillo. Let me tell you what McDonald's in Amarillo does. As soon as you walk in the front door, you don't even have time to look up at the menu board. Can I help you, please? This is what you hear when you walk into a McDonald's. Welcome to McDonald's. May I help you, please? What they are trying to do is they're trying to take your order as fast as possible to get your greenback dollar as fast as possible and get you out the door. There's even signs inside the McDonald's here. You only have 30 minutes to eat. Or they'll call the police for loitering in their restaurants. Folks, if you don't believe me, go in there and look. It's in every McDonald's restaurant that you come to in Amarillo. When you order, you have 30 minutes to eat. 30 minutes to eat and dine in, then it becomes a loitering issue. Amarillo police will be called. This is what I'm seeing happening with Caprock Advanced Care. They don't take your insurance. All they take is cash. They want money. So it's almost like you walk into a Caprock Advanced Care. May I help you, please? Pay me $300, go see the doctor in the back, bye. If you don't have the insurance, to hell with you. That's my perspective of Caprock Advanced Care not willing to take insurance. And folks, by law, they don't have to. Okay, you can't force a healthcare facility to take insurance. But where Caprock Advanced Care sets itself apart when it opens, and we have done the checking on this, they will be the only medical facility in Amarillo that you can walk into that does not accept insurance. The only one when they open. Again, at the beginning of the podcast, you heard me talk about the two reasons I believe why they don't take insurance. Number one, either they're money hungry or they're dealing with a government slow payouts. I think we can all agree on the slow payouts. If you know anything about the government in releasing money, they're very slow to do such. They're even slow when it comes to your income tax refund. It's even slower, ladies and gentlemen, when it comes to paying out premiums to recipients. Recipients suffer. I believe that Caprock Advanced Care is a poor decision for the Amarillo area based on they do not take insurance. You know, not everyone can walk into a freestanding clinic with $1,500 in their hand and greedy doctor's hands snatch it out, get in the back. I'm going to treat you as quickly as possible. We're going to make believe that we care about you. Then we're going to kick your ass out the back door. Folks, I'm not trying to offend anyone. I'm telling you like it is. Case in point. Now, if you're not an Amarillo resident listening to this podcast, you're not going to understand this at all. But Amarillo residents will confirm this. Have you ever been on Coulter Avenue about 7:30 Monday through Thursday, trying to go north toward the hospitals, toward Northwest Texas, toward BSA, toward the Bone and Joint Clinic, toward Texas Tech School of Medicine? What do you find at that time of the morning? A damn traffic jam. Why? It's because everybody is going to see the doctor. Like I said, folks, there's sick people. Not just in Amarillo, it's everywhere. But you also notice that I said Monday through Thursday. Well, Alan, what happened to Friday? Most of the doctor's offices, ladies and gentlemen, are closed on Friday, and I'm going to tell you why. It's because the people in Amarillo wear these doctors out in 4 days' time. But even the wore-out doctors, the wore-out nurses, the wore-out staff at these doctors' offices, they do take one thing. They take your insurance. Caprock Advanced Care is not going to do that, ladies and gentlemen. Why is that? I believe it's money hungry. I believe it's like a McDonald's. You walk in the door, may I help you please? In other words, what that person behind that counter is saying is, hurry up and give me your order where I can get your money, get your food, and then get out of here. That is my own personal opinion, ladies and gentlemen. I believe that Caprock Advanced Care is not suitable for Amarillo. I think they have, and I think Dr. Matthew Turney has great intention for Caprock Advanced Care. But it's almost like the staff at Caprock Advanced Care makes themselves, the right word for this would be special, that they're not going to wait on the government. They're not going to wait on the insurance companies to pay them. They're better than everybody else. We want our money now and get on down the road. Folks, I think that's a bad, bad way to look at something. These doctors and these staff members that will be working at Caprock Advanced Care are no better than anybody else walking around in a Walmart or a Market Street or a United supermarket. They're all human beings just like everybody else. But I think Dr. Matthew Turney and his staff are showing very poor judgment in doing this. I think they should have to wait on their money just like any other doctor should have to wait on their money. And folks, it is what it is. I mean, for an example, you have chiropractors out there. Let's use chiropractors for an example. A chiropractor, they take insurance. They may wait a month. They may go in there and crack somebody's back, and it'd be 30 days before they even see a penny from cracking that back. Caprock Advanced Care don't want to do that. They want their money right then and there. It's almost like they're acting like a collection agency, but wanting to provide you with quote unquote excellent medical care. When did money become more important than health care, ladies and gentlemen? Well, let's look at Northwest Texas Hospital. Let's look at BSA Hospital. That's not the way the system works in this country. You walk into an emergency room, the number one priority is, if you're in bad condition, is to get you treated, get you stabilized. They'll worry about payment later. And that's in any hospital that you go to in the United States of America. Your health is number one. Pulling the money out of your pocket is number two. Not the case with Caprock Advanced Care. Caprock Advanced Care is money first, then your health. Only if you're a non-subscriber, because you can walk in with no subscription, be treated, and then be billed. I think that's a very poor decision on the discretion of Caprock Advanced Care. It almost, again, folks, makes it sound like they're only after your money. It's like that McDonald's. You got 30 minutes to eat, loitering, police called, bam, bam, and bam. Folks, this is not right. But then again, this is not the only business in Amarillo that has made poor decisions, okay? A lot of businesses have gone out of business because of poor decision making. And this is what makes me think, from a professional standpoint, that Caprock Advanced Care will not make it here in Amarillo because of poor decisions of not wanting to take insurance. Simply because either, again, they're money hungry, your money is number one priority, then take care of your health, which goes against everything else in modern day society. It goes against hospital standards and everything else. Or they just don't want to wait on the government to pay out. And a lot of that is Medicare, ladies and gentlemen. I think Dr. Matthew Turney and his staff, I think they have good intentions. And from a professional standpoint, I believe they do have good intentions. But it's almost like you're singling out those that are not as fortunate as you are. Okay? if these people don't have a pocket full of $100 bills, you don't want to see them. It's almost like you're thinking about yourself first before putting the health care of other people that you wish to serve above you. Ladies and gentlemen, it's not right. I mean, Caprock Advanced Care can do what they want to do. But just because something isn't right doesn't make it right to do. Again, I think it's a very poor decision to start a business off that way, not accepting insurance. Because, ladies and gentlemen, some people, that's all they've got. Some people have nothing more than insurance from the government to take care of them. A lot of people, believe it or not, are still on that old Obamacare, which don't amount to a hill of beans. Okay? But it's the bare minimum requirements that will get somebody by. It's almost like Caprock Advanced Care doesn't trust the government. Well, if that is the case with Caprock Advanced Care, I'll be the first to step up to the plate and I'll agree with them. I don't trust the government either. But I don't think that's the case, folks. I think number 2 is ruled out on this. I think it is money hungry. Yes, it wants to be the fastest healthcare facility in and out in Amarillo. And that's exactly what they're trying to do. They understand that you don't want to go to the hospital and sit there 12 to 16 hours before you're seen by these these are foreign doctors, hospitalists, I believe is what they're called. And I'm not even going to get into that. That is for a completely different podcast. But some of those doctors, and I hate to be the one to say this on the podcast, but a lot of those hospitalists that they hire that come from these overseas, they don't know their ass from a hole in the ground. Okay? But this is true, that a lot of people will go and sit in an emergency room for 16 hours before a doctor sees them. And I think Caprock Advanced Care has looked into that. And yeah, they can beat that 15 times over. They can get you in and out probably in less than an hour if it's not something major. And I believe that's one of the reasons that Dr. Matthew Turney thought up this idea. That they wanted to be like a freestanding clinic, in and out, like a McDonald's, but without all the restrictions that the hospitals put on them. But I think that Caprock Advanced Care, again, is making very, very poor decisions in judgment on this, because while there are a lot of people in Amarillo that do have a lot of money, there's a lot of people in Amarillo, folks, that don't have a lot of money. And Caprock Advanced Care is not going to get these people services. They're going to go somewhere else, and they may have to sit a half a day. But before they'll set foot in Caprock Advanced Care and be billed to the point that they'll have to sell their home to pay their medical bills, they'll go sit in the emergency room and let the government take care of it. Check out their webpage, ladies and gentlemen. It is caprockadvancedcare.com. Go through it. Read it. You be the judge. Is it good or is it bad for Amarillo? And with that being said, that will wrap up this Friday Sunrise edition of the chat. As always, you can go to allenfitts.com. That's ALLENFITTS.com. And scroll down. and look and see what the next upcoming topics are of discussion here on the Alan Fitz podcast. Remember that those are subject to change without notice, but we do try to keep it updated as much as possible. I do hope you're enjoying the Monday through Friday ticker, the news ticker that is on alanfitz.com. Also, I'd like to throw up right quick before we sign off this morning, if you haven't already noticed it, if you go to alanfitz.com, click on the More tab and scroll down, the Dallas Cowboys football schedule, the entire season, has been put on the webpage. There's a lot of Dallas Cowboy football fans up here, and we wanted to throw that in just to let you know who they're playing and the times and on what television or cable station. Folks, have a great Friday, a wonderful weekend, and my friends, until we meet again next Friday morning here on the Alan Fitz podcast, this is Alan Fitz for the chat saying bye for now.